Behind every great doctor is often someone holding it all together behind the scenes. In this special 2-part bonus series, we're sitting down with the people who truly helped build Seth Premier Medical and Parker Medical from the ground up, our spouses.
In part 2 of our bonus series, we turn to Jason Parker, the powerhouse behind Parker Medical's operations. A former Coast Guard and HR expert, Jason opens up about supporting a physician, building a business from scratch, and what it takes to protect a staff, lead a clinic, and grow something that actually works for both patients and providers. All right, welcome back. We're here with Mr. Jason Parker. Welcome.
Hi, thanks for having me.
Yeah. So we're doing a little bit of interviewing of the integral people involved in our practices. So I wanted to ask you a few questions about your relationship with Parker Medical, how things have evolved, and so I was wondering if we could start off start off with your story. Tell me when you met Dr. Parker, and a little bit of the journey of how that started.
Okay. So Dr. Parker, Ryan and I met in 2010. I was stationed in Portland, Maine with the United States Coast Guard. I was the recruiter in charge for Ollie of England, and Ryan was finishing up his residency up in Portland, at Portland, Maine Medical Center. That's how we met, and later got engaged and moved to Las Vegas, where the practice currently is.
So, did you guys always know that you wanted to start off building a primary or a concierge medical practice?
I don't think that's something we ever really talked about. He had interviewed at a couple different places. Ended up, we settled around Las Vegas, was where we were going to call home. We moved to. He was working in a traditional primary care office, seeing 30 to 50 patients a day. Was starting to get a little burned out, but did that for a number of years. He was approached by a large healthcare organization, a fitness center, a gym, essentially, and they wanted to start a concierge medical practice.
Okay, and how was that? Were you part of that, or? I wasn't
really part of that. So when we moved to Las Vegas, I had been in the Coast Guard for 12 years. Vegas is landlocked, so we made the decision for me to get out. And I had a background, in the military. I had a personnel background, so I dealt with human resources. So I went to work at a local community college and their human resources department.
Okay, so you said you were in the military for 12 years?
Coast Guard.
What was your role? What was that like?
So I was a petty officer first class. I handled, the official time was a yeoman, but it was all personnel related. So, payroll, personnel matters, complaints, stuff like that.
Okay.
So it's really been pivotal in my role in Parker Medical, because that's all I do. I oversee everything non-clinical related. All the staff report to me. I do all the talent acquisition, employee relations, everything like that.
Interesting. So if you started off in military, you did your HR. When you were in for 12 years, and then you decided to leave the military when you guys moved to Las Vegas?
Yeah, so when Ryan and I got married and we decided that we were going to move to Las Vegas, my original plan was to retire from the military. And then when I found out that, hey, we're going to go down a different path, that's when I decided to go back to school. I got my bachelor's in business administration and then went on and got my master's degree. So by the time we landed in Las Vegas, I had an MBA with a concentration in organizational management. Amazing. So that's, again, been very helpful in my role here at the practice.
So so where did you do your training for MBA?
A college in Maine, Bangor University.
Bangor University. So that's where you were. Then you got your training there, and then you decided that. And so you worked at a community college. Were you a professor there?
No, just working in their human resources department. So I started as a kind of a talent acquisition recruiter, doing all of their recruitment for their professors, their administrative positions. And then by the time I left the college to for us to open up Parker Medical. I was the one of the directors at Human Resources.
Oh, really? So obviously,
Promoted very quickly. I was there for a total of 4 years. It went in as an entry level position and then left as pretty high in the organization.
4 years, you were able to move up the ladder very quickly. That's crazy. So tell me the story of when you and Ryan decided to branch off and to take that jump into private practice.
Well, it was 2016, and Ryan came home one afternoon and said, you know what? I have started a concierge practice for this other entity. I'm not very happy with the way that they're calling the shots, and I think I can do it better, and I'm going to open my own practice. And I said, okay, I support you. We have bills to pay. What are we going to do? How are we going to make this work? You know, and so for a solid year, or at that point, we started Parker Medical. You know, as you know, you don't just overnight start a business. So there's a lot of work leading up to that.
Right.
But by the time Parker Medical, we opened doors, Ryan worked for one solid year, 4 days in the clinic, in our clinic, and then 3 days in an urgent care just to make ends meet, you know.
So you guys decide to take that risk. He decides to leave his current job,
Yes.
open up a private practice, and you also decided to leave your job.
Oh, no, it's just so I stayed at the college at that time. I was again pretty high up in the organization within the human resources department. And it was pretty much, you know, it was paying our bills. Don't get me wrong. And the goal even at that time was never for me to leave and go to work, you know, with my husband. You know, I had career plans of my own. Right. And as you know, we're very fortunate the practice took off. It was very successful. And as the practice got busier, what I found myself doing, I was working in the evenings for the practice. You know, I was doing payroll on weekends. I was processing insurance checks. I was doing everything. I was working during the day and then going home or stopping by the practice in the afternoons and working a couple hours in the practice.
So in other words, not only did Ryan work 7 days a week for 1 year, but so did you.
We did. Yeah, we did it together. But you know, we made it work. We knew what the vision was. You know, I hadn't even heard of concierge medicine at the time. Again, I did 12 years in the military. If I got sick, I just showed my ID card and then went on base somewhere. So yeah, the concierge medicine role was different. It was new to me. But I had faith in Ryan, and I knew that he had already done this for another entity, so he knew the administrative side. So I wasn't really worried that we couldn't do it. I was more worried, is there that many people in the world looking for a concierge doctor willing to pay a monthly membership? Yeah. And there were.
Yeah.
So we did that for a solid year, and Ryan had finally came to me one afternoon and he said, hey, you know, the practice is getting really busy. It's getting hard for me to manage the clinical side and the administrative side. I think I need your help in the practice. And I said, well, what do you mean? What does that look like to you? And he said, I think I want you to come and work in practice. Yeah. And I said, are you sure about that? Yeah. And live together. Yeah. You know, do you want to work together as well? Yeah. And we had a lot of conversation. Yeah. We talked to a lot of our friends who, you know, work and live together. Yeah. And we just made the decision, okay, this is what we're going to do. And I left the college, I went to the practice, and I really haven't looked back. It's been a good move. We get along well. It affords Ryan really the opportunity to just focus on clinical requirements, clinical needs, the needs of the patient, and all of the administrative burden really falls onto my shoulders.
So I want to go back into that. I want to go back into that time when Ryan asked you to come to work to you. Because I remember it was like a week where I had to like talk to Nira about this. Because when Nira and I decided to move to Tampa, and she had a fantastic job, which she loved. She was moving up. She loved all the people that she worked. There was a lot of salesmanship for me. And so I want to know what it was like. What was the conversation there? What was it like with the conversation with Ryan? And what were your fears at that time?
Thinking back, I think my only fear was, you know, I'm a very practical person, and COVID wasn't even something on the horizon at that point. You knew nothing about it. My fear was if the business is not successful for some reason, well, both of our incomes are coming from the practice. I'm always sometimes a cup half empty kind of person. I like to have a backup plan. So that was really my only fear. We'd only been in Vegas for a couple of years. And it's not like we were leaving Vegas to go do this. So I wasn't worried about losing friends or friendship. A lot of my colleagues that I worked with at the time were even actually much closer now because we have relationships outside of the office, whereas before we did more across the lines.
Right.
So that was really my only fear was if this isn't successful, have I put all my eggs in my basket as a family? Have I put all our eggs in my basket? We don't have children, so that wasn't really a hard sell for us. But at the end of the day, mortgages start to be paid, cars start to be paid. We still have to live a certain lifestyle that we've become accustomed to. My only fear was, again, putting all the eggs in the basket. But by the time we made that decision, we were probably 150, 200 patients into it. The business was very successful.
Yeah.
We knew that we can make it work. And so
you guys had a panel of about 150 patients by the time you started?
yes, by the time I left my job, so I needed to, again, we had a lot of little conversations about it. It wasn't an overnight. And I mean, the decision, once I knew that was the decision, we kind of put a game plan. Okay, when we reach certain number of patients, that's when I'm going to make the switch. And that's what we approached it.
Do you regret any of the moments, or are you happy with the decisions?
No, I'm very happy with the decision. Coming on board, as a business owner now, and you're starting your own practice. We're having our own practice now. With you having your wife in the clinic, I absolutely love her to death. She's going to help you in so many ways with personnel issues and stuff like that. Your staff, when you start to hire staff and you have all these individuals reporting to you and essentially depending on you for support, sometimes your patient care is going to suffer a little bit. So I don't regret the decision that we made. It's been no other person that you could bring to your clinic is going to have your back as much as your spouse. As long as you guys have a good relationship leading into it.
Yeah. And actually I think that's a great point. I think you brought this up. And so for our viewers who are new to our system, Jason, you have been incredibly instrumental in the development of our practice. And honestly, helping our marriage. Because the best thing that has ever happened to Nira and I is working together. She wants to kill me once in a while, but generally she likes me. And I think it's an overall positive. We work very well together. I also, I listen a lot more because she's so important.
Yeah.
And because she's so important, with your guidance and all the things you have learned and Dad also taught us, she's the most invaluable resource in my not only my life, but my business practice and everything. So tell me a little bit about the process of how you developed your understanding of because your experience was HR, you have an MBA, but now this is clinical medicine. This is totally different.
I was just thinking back, you asked me what's my biggest fear. I do have another fear. Yes, I know organizational management. I know human resources policies left and right. I have no clinical background. So, I think back to one day when we first opened. The first week we opened, I actually took the week off from the college, and I was at the practice, and I was helping just with phones. And here I am with the MBA, scared to death to answer the phone because I don't know anything what these patients, potentially want or the questions they're going to ask from a healthcare standpoint. And I remember just being like, I don't want anything to do with patient-focused relationships. But I'd say within 6 months of working in the clinic full-time, I really got over that. I stayed in my lane. I focused on, I spent the first week because, again, the practice had already been open for about a year. We had 150 patients. We were staffed. I hired the staff, but I was coming in the evenings. I was coming in on the weekends. I did not have direct one-on-one relationship with the staff, even though I was part of their hire. So what I was able to do the first couple of weeks was just sit back and watch, figure out what was working from an organizational management standpoint, figuring out where things getting bogged down, why our staff spending so much time doing this or doing that. I didn't have to understand anything from a clinical standpoint. I just knew we could kind of speed things up or better oil the machine in a way.
Right.
And that's what I focused on.
So, and during that process, the learning, were there any moments of like, eye-opening moments? You're like, oh my gosh, this is not what I was expecting. Can you give me an example of that?
Not so much really things that I wasn't expecting. I just think it's Ryan and I have two different personalities. Ryan grew up in the Midwest. He is wants to please everyone. He thinks everyone has just the best intentions. I, on the other hand, am very no nonsense. I'm very direct. And sometimes what would in there first would get confusing would be if I saw someone being rude. My background again being human resources, part of that's customer service. When I saw a patient or someone that we were interviewing to be a patient really be rude to a staff or rude to the provider, Ryan, I would take it personal. Okay, no, you're not going to act that way. It was just not the office for you. And I had to slowly learn how to navigate different situations.
I think people don't realize that healthcare, as much as you try your best in service, you deal with so many variety of patients and people that like rudeness is very common. And sometimes it's coping mechanisms, sometimes it's their medical issues. There's a lot of it. And patients get a pass a lot of times. Nurses in the hospitals, they get physically assaulted, verbally assaulted. It's an epidemic in the United States. And I love the fact that when you had talked to Neera and explained to her about how, there's a little bit of you have to be careful and protect your own self too. And don't allow don't allow the rudeness all the time.
I have a zero tolerance for it. We're all entitled to a bad day. Absolutely. I have my days. But you could cross the line if you ever cuss at anyone in our staff. We're not an inpatient setting, so the things that patients can get away with or customers can get away with in a hospital setting, you just can't get away with in an outpatient primary care office.
Right.
I mean, you can just take that business elsewhere.
Right.
So I have a very zero tolerance. If you are really rude, cuss, profanity to any member of my team or to the doctor, that's it.
Your staff must love you.
I treat my staff really well. They know that both Dr. Park and I have their best.
Yeah.
And I support their decision 100%.
Right.
And they know that if a patient crosses a line, whether they say something that's borderline sexual harassment, they come to me, we deal with it, the patient's gone. So I think that's really important to have the staff's back.
Yeah. I think that's something that's like huge in current healthcare. There's a lot of staff and sometimes they don't feel like they're supported. And I think like your unique vision of a no nonsense aspect of support for your staff, I think it's a game changer.
Well, here, I think in today's environment, so you have, we're in the role, it's social media is everywhere now, right? I think so many people are just used to hiding behind a computer screen or a phone or a tablet and saying whatever they want and getting away with it. They bring that into now businesses where they feel like if they beat on their chest, they're just going to get whatever they want. And some businesses will kind of cater to that. Before I came into the practice, Ryan would sometimes, it was easier to just go along with whatever they wanted because you didn't want to deal with it or have to say no, or just he just didn't have the capability at the time to deal with it. So they just got away with what they wanted. So that first year I was in the practice, I was honestly cleaning up a good bit of non-desirable patients. Seems like, that were just, if the phone rings and our medical assistant is like, oh my goodness, this person again, like there's a problem. So I need to investigate that, figure out what's going on. And there were some individuals that we just we just weren't a good fit. Right. And we weren't meeting their expectations. Let's just end that relationship.
No, are there other situations where it's not the case, where they may have been upset or something?
Absolutely. Absolutely.
Give me
It's a matter of just communicating with the patient. You know, it's just, you know, I don't just always take the staff's word for it. You know, I investigate. I will call the patient. I'll go and I'll talk to, or the vendor. It's not always a patient, it's a vendor.
Yeah.
You know, you've got to do a good job of practicing active listening, you know, emotional intelligence, figure out what's going on. All the things that, you know, Nira is going to do for you that you do not have the mindset that, you know, you're going to be focused on patient care. That should not be your area of responsibility.
I think that's the genius of your model, where you emphasize that Ryan's focus is clinical only, and in my case, Nira's situation is just the administration aspect. No, obviously, Nira has a clinical background with nursing, so she blends a little bit. But the reason why I love this is I am taken out of the day-to-day details, the vendor calling, the bills and stuff like that, and it makes me focus on the clinical part. It makes me not distracted. You know, I notice that as a business owner now, and starting a business, sometimes I'm thinking, am I under or overbilling? And I'm worried about that. And I realize, like, no, I just got to focus on the clinical part, because the clinical part is what I need to do. And if I start focusing too much on those things, I get distracted, and I can't do that.
Well, at the end of the day, your business is a clinic. If that part is not successful, everything else is going to fall apart. So that's your area of expertise. That is where you belong. That's where Ryan belongs. That is that you cannot manage both of them successfully. The organizational side and then the clinic side, you're just not going to be able to.
So now you told us a little bit about the first few years.
Mm-hmm.
So you guys developed a structured MD. Yes. So tell me a little bit about structured MD.
So when we first opened Parker Medical, it was kind of born out of necessity. When we first opened Parker Medical, we were presented with a consultant that was to help us open the practice. And we quickly realized the consultant, they were doing 60% of the job, but there was 40% of it that was just falling the wayside, that they were claiming that they were doing it, they weren't doing. So after a couple of years and us doing things on our own and learning some things the harder way, we decided, and we were getting phone calls all the time. We started a lot of phone calls on, hey, I'm a new doctor. I've been practicing medicine for a while. I want to open my own concierge. Will you tell me how you did it? And I thought, why would I want to tell my competitor how to do this?
Yeah.
And so Ryan and I sat down one night. We said, you know what, we should really brainstorm and figure out, we won't help the doctor right down the street. They're our competitor, but there's a market out there to educate doctors on how to start a concierge business. I mean, that's where Structured MD was born. So I actually own Structured MD, and the reasoning for that, or the rationale, is just that: help other doctors create concierge clinics. And we really tailor it to how Parker Medical runs. Parker Medical has been, knock on wood, it's been very successful, but it hasn't always been with the right decisions made on the business side or even the clinical side. We've fine-tuned things, we've changed things, we've chosen vendors that we've had to change vendors, or I think we went through 3 medical billing companies before we landed on the one that we're with now. And that is the most horrible thing, because you always have to change medical billing companies at any point.
Right.
So we've taken all the tools that we learned and the things that we would do again and not do again, and we package it up, and we really educate doctors on how to start a concierge business and why, and ask them questions of, why do you want to start a concierge business? If a doctor tells me, well, the reason I want to start because I want to make money, I'm like, no, that's not the right answer. I want to work with doctors who, at the end of the day, really just want to provide a better experience for their patients. You're going to burn out seeing 30 or 40, 50 patients a day. You just cannot do it. So wonder doctors can even get off practice. I mean, there's just, at any given moment, something can happen. If you're only going to spend a minute or two with the patient, you're overlooking a lot of things, and something's going to happen.
Right. So I'm going to give you a little background on why we ended up going with you and why we ended up using Structured ND. Prior to me moving out to Tampa, I had Googled concierge medicine, and I literally only found one place, and it was a law firm that was willing to set up concierge programs. So I signed them up. I emailed the guy, big national firm, and the guy responded back saying, "Do you have an established practice?" And I said, "I don't have an established practice." And he goes, "We don't work with anyone unless there's an established practice." In other words, if you had a panel of 1,000 patients, we could turn it around or to a private and to a concierge practice. But if you want it from the ground up, it's impossible. Okay, possible. Yeah, exactly.
And it'd be a little bit more hard work.
Yeah. And then the second step was, well, I was looking around trying to figure some things out, and there are some options. But I flew out to Parker Medical. Yeah. I saw what you guys were doing out there, and I went back home. I called Nira. I said, "This is what we got to do. This is the practice that we got to follow. They figured it out. Now, like you and I know, every practice is different.
Right.
It's not all it. But what I was really struck with was how well your system flowed. Your patient's experience was so good. The staff were all very, very happy, and it seemed like that was flowing well. Your doctor was very happy, and to the point where he was like, maybe I can do more. And that idea of having a physician not having to worry was an incredible, it was a light opening moment for me. I was like, this is the model. So what do you think is the future for you guys at Parker Medical?
So from a business perspective, the goal is always to get more providers. We want to have as many providers as we can under our belt to an extent. At the end of the day, we'd love to own our own building, bring in more services, have a full flight, have a cardiologist, have all of these other types of specialties in-house. But ultimately, in the day, it's really just about the patient experience. We really just want to focus on providing outstanding patient care to the patient, just primary care needs. That's the focus.
So just like polishing that diamond.
Constantly. Exactly, because that's what the patient is paying for. They're paying a membership fee, yes, for a concierge model. You provide the service, and that's why when you came up, you met, and your concern was you didn't have already an established panel. I said, look, as long as you can financially support yourself, and you're not going to have patients right at the gate, the patients will come based on your reputation. Once you sign on 1 or 2 or 3 patients, they're going to tell their friends, word's going to get out, and it's all about your reputation. Don't try to offer all these other services like a med spa and all these other things. Focus on providing outstanding primary care, because that is what most of the communities really are hurting for. At least in Las Vegas, we have such a system where the population, we don't have enough primary care doctors to meet the growing population in Las Vegas. And so that's one of the reasons we're so successful. I'll be honest, concierge medicine will not work everywhere. I grew up in a very small town in South Carolina. A concierge doctor, in my opinion, would not work well there because they're already getting concierge level of service without having to pay a membership. Of course, they're not waiting months and months to get in and see their PCP. Of course, but you move to a larger city, New York, we have friends there that have concierge doctors, places in California. Those areas, that's where concierge medicine is going to be the most successful, is because there's not enough providers for the population.
Do you see concierge medicine in the United States have a positive future?
I think so. I mean, until, and again, I don't have a clinical, my area is not on the clinical side, but I can just talk about from the business. Yeah, from a business, unless insurance systems change, I don't see that concierge medicine is going to do anything but grow, because more and more doctors are going to get fed up with getting very small insurance reimbursements. They can't keep their lights on. That's why they have to see 30, 40, 50 patients a day just to keep their lights on. Their malpractice insurance, keep the staff paid, That is why they overbook.
This is a response absolutely issue.
Absolutely.
That's amazing. Jason, it was a really good meeting. It was a really great opportunity to interview you and I can't tell you how thankful myself, Nira, our business is to meet Ryan, but really to meet you.
Well, I have no doubt that you guys are going to do fantastic. I've had an opportunity now to tour your clinic, and I know that you and her are going to do really well, and I'm always here if you guys need anything.
Thank you so much.